Everybody, welcome back. Today our topic is incontinence with amazing women's health dance physio. Okay, so let me introduce myself. My name is Ange or Anjali. My profession is women's health coach and nutrition counselor. Okay, and I'm the founder of this page. So now please let me help me to welcome our guest, Heidi. Thank you so much, Dr. Tanya, for coming here today. We are having a little bit of technical difficulty, but hopefully this time it will work. So it's our third attempt. So thank you so much for coming here today. Yes, so we are going to read a beautiful bio of Heidi. Okay, so I'm trying to find Heidi here, and Heidi is a passionate women's health and dance physio and loves making positive and meaningful changes in her patients' lives. She has extensive experience in both the public and private sector and worked as a senior women's health physiotherapist in pro and postnatal. Not pro. Sorry, my English is a bit shaky today. Yes, and she has worked in OASI and urogynaecology pelvic clinics at GCUH, as well as working in the first endometriosis clinic in Goldcoast. Thank you for coming back. And I'll be trying to find Heidi. Because she is, yeah, okay, here she is, okay, viewer. Yes, so she has done Bachelor in Health and Science, Masters in Physiotherapy, Women's Health and Musculoskeletal Physiotherapist. Hello, Heidi. I'm just about to finish.
I'm lucky.
Yes, I'm about to finish my bio. And you are Pilates instructor and ballet teacher, right?
Correct.
Yeah. Thank you everyone for coming here today. And we've been trying to play around with our technical difficulties, and thank you for being so patient. Thank you so much. And please help me to welcome our wonderful guest, Heidi, who is the women's health physio, dance physio, right?
Correct.
Yes. So before we start, I just wanted to say this important message that this live is all about to bring awareness, educational, and general information. And if you have any incontinence issue, please go and seek out for help with your closest health professional. Or if you have any question, please stay till the end of our live and we will have Q&A session. Okay, so yes, would you like to add anything there, Heidi?
In terms of my bio, no, thank you. Thanks for explaining that whilst I was connecting in and out. Yeah.
Yeah, it brings resilience and character in us, you know.
Technical
Yeah,
issue,
truly. And
for sure.
how you deal with the situation, right? So, yes, yeah. So, but anyway, should we jump right into the question? Yeah.
Yeah, sure.
Yeah. So, as a dance physiotherapist, what are the different types of incontinence that you mostly come across?
Incontinence. So there's multiple different types I get with my clients. But if I'm speaking specifically in terms of the clients that I tend to see, which is dancers and women's health, then I would mainly get two types of incontinence. So the first one is stress urinary incontinence, and the second one is urge incontinence. So before I kind of explain that, I think it's really quite important to know the anatomy as to what I'm talking about with incontinence to begin with.
Yes.
So I think I might just explain a little bit more in regards to the anatomy first, and then I'll explain into more detail about the two types of incontinence that I normally see.
Fantastic.
So in terms of the incontinence, so if we're thinking incontinence, I'm talking about leaking. So leaking of either urine or feces, but generally I tend to see more leaking in regards to urine. However, of course, leaking can occur as well with your bowels. Now, this can occur in like all different age groups as well. So I do, it's not only where we used to think it would occur after babies or once we're older. No, actually leaking can occur from all sorts of ages, literally from the clients that I see like I'd say 12 upwards, up until around my oldest is probably 90 years old right now. So anatomy wise, I guess it's important to just know in regards to your pelvis. So when I say your pelvis, that's pretty much the bony region that connects your torso to your legs. And inside your pelvis, for females, if we zoom into here, I hope you guys can see that. Inside the pelvis, we've got three main organs. So we've got your bladder over there, your uterus, and then your bowels, and they're held by little strings of connective tissue that help keep your organs in place. And then we've got your pelvic floor muscles that support the entrance and exits of all three organs. Okay. So when I'm saying the first most common type of leaking that I would say is stress urinary incontinence, which is essentially leaking that you get with coughing, sneezing, laughing, or if you're jumping on a trampoline or if it's running. It's more when there is a bit more load or impact onto your organs, and your organs or your pelvic floor muscles is just not able to cope with that extra load. So that's probably the most common one that I tend to see. The second most common cause of or reason that someone might get leaking is due to urge incontinence. So that's more just in regards to the bladder. So when I'm talking about the bladder, it's also important to understand also how the bladder normally works. So think of the bladder a bit like a balloon. And with the balloon, as it fills up with urine, that balloon starts to grow and grow and grow in shape. And as it starts to grow in shape, just as much as when we have pressure on the balloon walls, that itself also has pressure on the bladder walls. And that stretch of the bladder wall sends a signal up towards the brain of going, hey, you got to go pee soon. And once you decide you need to go to the toilet, or once that bladder or that balloon is quite full, that's where we get a signal back down, sends a signal back down, says, okay, need to go pee, bladder walls contract, pelvic floor relaxes, and then everything comes out when you pee. When you have urge incontinence, it's essentially more irritation around your bladder and the balloon walls, which can cause a bit more of that sensitivity. Hence why you might find that you may get more leaking on the way to the toilet, or if you see some water, or if you have certain things that might trigger it, that's where you might get more of the second reason of incontinence, which is urge incontinence.
Yes. So the one is so correct me if I'm not correct.
No.
So stress incontinence first, stress incontinence and urge incontinence. Is that correct?
Yes, those are two types. And one is just more due to the increase in demand on the organ or the pelvic floor, and it's just not able to cope with it. And that often occurs with coughing, leaking, running, exercise, or this is where it's where we have urge incontinence, which is more irritation towards the bladder walls.
Yeah, and that was really informative. Thank you, Heidi.
No worries.
And so there will be two types of incontinence, and you know, and it's great to know that it not only, you know, most of the time we only think of happening with the mums after giving birth, but it can happen in any time of the, you know, of your life. Is that correct?
Completely.
Yeah.
Definitely.
Yeah. Awesome. So so we will jump into the another leading towards the another question. So how do we manage these two types of incontinence? So stress and urge incontinence.
That's a big one because everyone's different as to the reasons why they may get that leaking, right? So if we're talking, let's first break down, I guess, stress incontinence. So stress incontinence, there's multiple reasons as to why you might have that increased load to begin with. So let's talk about the most common cause, but understand that the management of it is going to be dependent on your own reason as to why you're getting the leaking to begin with, and that's what a women's health physiotherapist will do. They'll assess, they figure out what your or what type of leaking you have and what are the causes of it, and then based on the cause, then they'll target and create strategies for you. So really, I guess everyone's different as to the reason as to why, but I'm just going to talk about the most common reasons. And probably the most common that we've already heard of is due to weakness of the pelvic floor. So when you cough and you sneeze, that puts that pressure onto the bladder. And if, yes, of course, that pelvic floor muscle is not able to cope with the demands put onto the bladder, because the pelvic floor is weak, then yes, this is where you may get some leaking accordingly. So hence the management of that is, yes, pelvic floor exercises. That is probably the most common reason, and that's why people will tend to do their pelvic floor. However, what I do tend to find for me is, especially with my clientele that I tend to see, which is dancers, as well as gymnasts, as well as clients with endometriosis or chronic pelvic pain, they're more due to, in the instance of their pelvic floor being too tight. So when a muscle is too tight, it is going to be weak. So I want you to think of a bit more like muscle. We first got to understand a bit more about muscle tone. So I want you to think about your pelvic floor a bit like a bicep muscle. So with your bicep, essentially we can have your bicep completely relaxed, so straight, or we can have it fully contracted, as we pick up a handbag, or we can have it middle tone, right? Now, ideally at rest, we want your bicep to just be fully relaxed. You've dropped that handbag, you've come back home, you want to just drop that handbag, make sure it relaxes. However, this is where, of course, when our muscles, or if we don't drop that handbag, then we're constantly holding that, and there can be this resting tone of tension on your bicep. Now, let's say if I tell you to actually lift up and you're holding that bicep and you're holding that handbag throughout the whole entire day, decide not to put that down. And then I tell you to actually put another weight into your handbag, and then I tell you to lift that up. Is that muscle going to be strong, or is it going to be weak?
Extra stressed.
It's going to be stressed. It's going to be tired. It won't be able to lift that bag up again. And that's the same thing in regards to your pelvic floor. So what I do tend to find with, for example, dancers or gymnasts, or people with chronic pelvic pain, where what they do find is they just find it hard to actually relax their pelvic floor. That muscle's always constantly on, either due to, because when you're in pain, what do our muscles do? Our muscles automatically contract. It just holds that tension. And just by having that, that's where that itself leads to more weakness. So with people like that, that's where pelvic floor exercise is not the way to go. And it's actually more relaxation and just being able to target or bringing that resting tone of that muscle back to baseline. So you've dropped that handbag completely.
Yes, I see that in myself, being a PT, women's health PT. I realized that when I was teaching my clients to hold, and I was always clenching my, the glutes, and it was, and I start getting the incontinence. I didn't realize I must be so good at it, right? And I was feeling embarrassed myself, because I didn't realize, and slowly I realized, oh my God, I was tensioning the whole time, not letting it go.
Exactly.
Because,
Yeah.
And so,
And
yes.
I think what I'm seeing like really commonly as well is also due to, and especially, yes, also with the population that I see, which is a lot of dancers and gymnasts, and also a bit more of that younger population, aesthetics wise. So, so I'm currently, yes, in Gold Coast, sunny Gold Coast, and, everyone tends to exercise either just in their bra and their shorts, and that itself puts a lot of social pressure onto your tummy. So what do? We tend to contract your tummy up, and if you're constantly holding that tension too, then that itself, we forget to let that muscle go, and then hence we end up losing that ability for that muscle to completely relax, and hence also that muscle can just be weakened as well.
Interesting. So that was the stress incontinence. Now we will head to our urge incontinence. Is that right?
Yes. So urge incontinence, as mentioned, is more related to irritability around the bladder or the bladder muscle, which is called your detrusor muscle. So strategies that we can do to just help settle that irritability, a few things. Number one, of course, if you have any form of gut irritation or just gut unhappiness, we do need to address that. So that's where I do tend to work well with, a dietitian who specializes in terms of any form of gut irritability or bloating, just to ensure that we're managing that. The second thing as well is, of course, if your gut's unhappy, then generally your bowels can also be a bit unhappy too, and we need to address any form of constipation. This is actually also with stress urinary incontinence, where if your bowels are unhappy, then most likely that's going to contribute a lot to your incontinence that you're experiencing with your bladder. So really just getting your poo to be a healthy poo. And when I say a healthy poo, you want it to be like a soft sausage. So not anything too liquidy. You don't want it to be hard pellets, not a hard sausage. You want it to be like a soft sausage. And that itself can definitely decrease the amount of load onto your pelvic organs and also onto your pelvic floor. So we just really got to manage the gut as well as your bowel system when working with incontinence. Another way as well, definitely with bladder irritability, with your urge incontinence, we just got to make sure as well you're not actually sculling your drinks. So this is something that I do tend to do because when I'm seeing clients and I'm busy, and then in between clients, and I'll just scull. But what happens is when you scull a drink, suddenly think of your bladder kind of like a water balloon. So you've kind of gone from here, and then you sculled the water bottle, and then you've gone from here to something like this. The immediate reaction for your bladder is to contract afterwards, and that's where you might suddenly get this, oh my gosh, I gotta rush, and hence you might leak on the way to the toilet. So rather than sculling, you want to sip frequently versus actually sculling your drinks. So drink from a straw or place lots of cups around, so that just gives you that reminder to drink more frequently versus a lot at the time. Yeah, definitely. There's a lot more in regards to bladder retraining as well that you can do for retraining the bladder as well, and that's a whole different. It
is a huge topic, isn't it?
It is a huge topic.
Because of our time frame, we always have to keep short and then be general knowledge, general information, right?
No worries.
Yes, thank you so much. And then, any final advice to our community who might need to hear regarding the incontinence or who are going through this?
Yeah, so I think incontinence, first of all, is actually really common. So 1 in 4 people are going to be experiencing incontinence. But what's crazy is 70% of these people do not seek out help. Potentially that may just be due to the fact that it's a lack of awareness or lack of knowledge, or just something that potentially I know, my generations above, that's where we've just kind of lived with it. However, these are things that you do not have to live with. If it bothers you, if it stops you from doing things that you enjoy doing, or if you're concerned about it, please seek out help. That's what women's health physiotherapists are specialists in, and they can help you with in just figuring out what's going on, what the action plan is, and how we can help you reach towards your goals and just be able to do your thing without leaking.
Yes. Yeah, I think it is so important, especially for us mothers. We always keep ourselves, like
Yeah,
everybody else on the top, and we keep ourselves at the end. So, if we are going through this situation, I think it's always, putting ourselves first and, searching for help. And there are so many resources, and you just have to look for help or have a
completely.
phone call. Yes.
Completely.
And
But also as well, I think it's also really important to just talk about it. Like, I think
mm,
it's all when people come in and they're like, "Oh my goodness, I didn't realize it was as simple as this," or they're like, "I
mm,
wish I came earlier." But I think a lot of it, I think the more you talk about it with your friends, I'm always talking about my
yes.
like poo and
Yeah.
pee with my friends,
Very
periods,
attractive.
yeah, everything with my friends and my family,
Yes.
and they're like too much information sometimes. However, the more you talk about it, the more normal it becomes, and you just realize you're not alone with it, and it's not something that you got to live with. And I think if we can support each other and just realize that you're not
Yes.
the only one, and there is help out there, then
Yes.
then definitely
Go
that's
for it.
something that we should be
Yes.
doing. Yeah,
Yes. I'm sorry, but I have a plumber downstairs. So we have a bit noise at the
that's
background.
all right.
Yeah. So yeah, we are coming to around to the end of our lives. So I just wanted to ask our viewers if you have any question to Heidi, please comment down below. And while we wait for your questions, please, Heidi, let us know where we can find you and your services.
Yeah, sure. So you can find me on my website. So if you go to FEMME, physiotherapy and wellness.com.au, and I provide women's health and dance and gymnast services. And you can have a look as well what type of services I provide. Otherwise, you can just follow me on Instagram via this. I'm sure we can just link that through.
Yes,
Yeah,
absolutely. Yeah.
I am
And
based in Gold Coast. However, I do telehealth sessions with women and dancers all around Australia. So that's also an option that you can do.
that's amazing. So I wanted to, yeah, because I wanted to talk about quickly that you're working in first endometriosis clinic.
Yes.
And I was reading, yes, I was reading the article about it, and how awesome is that? That's
Completely. It is so
yeah.
good. It is so good. Due to government funding, they've actually piloted, I don't know how many clinics in Australia, but they've funded, I think it was like 27 clinics in Australia.
Wow.
And yeah, I've been really lucky to be part of the first one in Gold Coast, which is amazing.
Congratulations.
And it's honestly so good. For women to have that service, to realize that they're not alone with, significant or debilitating period pains.
Mm,
And with that, there's a lot of other symptoms too. So
yes.
not only is it, yes, period pains, but also or chronic pelvic pains. There are issues such as incontinence or
Mm,
decreased hip and back flexibility, as
mm,
well as for some of them, inability to have sexual intercourse or painful insertion of a tampon. There's multiple other signs and symptoms that you can work on
mm,
when you have endometriosis or any chronic pelvic pains.
It's so fascinating how big this thing is, big
Yeah,
topic is, can be,
for sure.
So yes, it's a bit hard to cram in a like 20 to 25 minutes.
I know. I
Um,
know.
yeah. So if you to our viewers, thank you so much for coming here today. And if you have any questions that you would like to send it to Heidi, I'll put the link in our content. And thank you so much, Heidi, for coming here today and for your amazing time that you put in for our community, and a little bit of hiccups here and there with the technology. And thank you for putting up with it. So thank you so much, everyone, for coming here today. And yeah, we'll see you soon, Heidi. Maybe in our event. Maybe you might. Yeah.
Yeah, no, definitely.
Yeah.
Thank you. Thanks for having me.
Yeah. Awesome. You have a great day, Heidi.
Same
Bye bye.
to you. Bye.
Thank you, everyone. Bye.